beans, they're good for the heart. The more you eat, the more you fart. The information shared on this podcast is for general educational purposes only and reflects the host's personal views and experiences. It does not constitute medical, legal, or financial advice, and no professional relationship is formed by listening to this podcast. As always, consult your own qualified advisors regarding your specific needs and practice. Thank you.
Hi, welcome to But Seriously. My name is Sonia Narang. I'm one of your co-hosts today. Super excited to have y'all listening. If you choose to, please subscribe. We'd love to hear from you as well. So make a note in comments or ask questions. And I'm going to pass it over to Dr. Soyka to introduce herself.
Hola! How is everybody today? Dr. Caroline Soyka, board-certified gastroenterologist and co-host of But Seriously podcast. We are very excited today because we have a episode on the docket for you guys that has been asked for repeatedly by multiple people. So we are going to talk about bloating.
Bloating and constipation. So, do they go hand in hand? Do they tango together? What's the deal here? So, let's start off with, can you give us a definition of bloating and then reinforce to us what the definition of constipation is? What are they clinically?
So, kind of to your first question, do they go hand in hand? And the answer is many times yes, but not always. But usually it's the first thing I think of when somebody comes to me with bloating is, are you constipated? So it's kind of the first thing that I have to either rule in or rule out because everyone who's constipated is going to be bloated. Now, not everybody who's bloated is constipated, but that's why we got to figure that out first. So that's kind of the answer to that. Constipation, I think we talked about this in maybe episode
We
1.
did. Yeah.
We can kind of like go back to it because some of the feedback we've gotten is people liked that conversation. So the definition of constipation is variable, but it's basically not having enough bowel movements, either voluminous wise or frequency wise or emptying wise. So incomplete emptying counts, not, if you're just having like little rabbit pellets, even though that's counts as a bowel movement, you're still constipated because you're not having complete evacuation. Or if you're just having one bowel movement, but it's once every 2 weeks, that's constipation as well. Bloating.
I love these words, voluminous, complete evacuation.
Yes. I mean, we're scientists after all,
I think of voluminous hair. I think of evacuation like Top Gun, eject the goose dies. So, these are the visuals. I love it. Okay. So I'm sorry I interrupted. So that's the definition of constipation.
Right. So bloating is a sensation. Bloating is a sensation of being filled with air, being distended.
That's when you like feel like you're pregnant or there's stuff going on. You're not just you are filled with hot air. So that expression comes from someone.
It's true. I mean, like, I can tell you the amount of times in a week a patient comes to me and says, like, I look like I'm 9 months pregnant at the end of the day, the end of the week, whatever. Let me show you a picture because it has happened to all of us. Like, if you've been bloated, you know what bloated is and who hasn't been bloated. So I think we all I don't know if I've said this in an episode before, but it's one of my favorite quotes, courtesy of my husband, who's probably like not listening to this podcast, but whatever. Thanks for your support, dude. No. Have you heard that Supreme Court justice who gives the definition of pornography? I forget who it is, but one of the old Supreme Court justices was like trying to define what pornography was. And he ended up deciding that the definition of pornography is you know it when you see it. And that's kind of like bloating, right? Like you know it. You know it when you feel it or see it
Okay.
or both. I'm sure there is some sort of formal diagnosis or diagnosis criteria, but regardless to say, or suffice it to say, I think that encompasses it.
But you're literally filled, like, why is it why am I filled with air? Like, how explain the mechanics of that.
Because well, let me explain to you this. So, have you ever seen a cartoon where there's like poop on the ground, right? Like our But Seriously logo back there, that little poop emoji. And what is above the poop emoji?
Usually
What is that?
heat,
What is that?
smoke,
Yeah.
gas.
Yeah, gas. Exactly. Because that's what comes off of stool and bacteria is gas, right? And so gas is air, right? So
Mm.
that is what is literally bloating you is gas. And of course, that kind of brings us back to if you're constipated and you have more poop, you're going to be more bloated. Now, it doesn't always mean it's from constipation, but bloating generally, at least to some degree, has to do with bacterial load. And probably, that can be related to constipation because if you're constipated, you have more stool, and stool is filled with bacteria. And the more bacteria you have, the more gas you have, so the more bloated you are. But also, you can be bloated from having imbalance of bacteria. So essentially, there are different kinds of bacteria. So probiotics, prebiotics, those bacteria generally are not as gas forming as some of the
Mm.
other bacteria that form like gases like hydrogen and urease and methane and different gases within us. And if you have more of those bacteria inside of you, you are going to be more bloated.
I
There's other
mean,
causes of bloating too. You can be bloated from malabsorption. So if you're not absorbing things well from a disease like celiac disease, for example, that's going to cause bloating. You can be bloated from infection like H. pylori, which is an infection that you can get in the lining of the gut. I sort of hinted at bacteria earlier.
mm.
There is an actual diagnosis of something called SIBO, which is small intestinal bacterial overgrowth, which is actual clinical diagnosis of imbalance of those bacteria, the bad ones and the good ones.
Mm.
There's other causes of bloating too that we always have to keep in mind, especially as a female physician who treats a significant number of female patients. Bloating does not always mean in the GI tract. If somebody's bloated, you have to think about gynecologic issues too. So I'm not going to totally touch on that today, but always keep in mind as a female that you're keeping up with your GYN health because I found a lot of ovarian cancer or uterine cancer, especially in older women that have new, lower abdominal or pelvic bloating. So we always have to keep that in mind. But yeah.
Yeah. I mean, um, so a few things like, um, here's a, I don't know. Have you ever seen those videos of cows? Maybe I talked about this in the first episode. I can't remember, but there's this great video on Reddit where sometimes when cows are bloated, they stick a little needle in it to release.
Mhm. Yeah, because they have
And
four stomachs.
yeah, I did not know they had 4 stomachs. And my best friend's the head of sustainability, and he would say, like, cows create a lot of methane gas, so it'd be really helpful if people became vegetarians because 'cause there'd be less gas being released. It is? Okay, yeah. So, like, sometimes like, I'm on a drug right now. What am I on? Gabapentin. We're trying to figure out a diagnosis, as you know, and one of the, side effects is constipation, and I do. I feel like I have a bigger pooch than usual. So how am I to understand? 2 questions. 1, which foods? Because sometimes my friends will say, "Oh, I ate too much. I'm so bloated." And I'm like, "Well, what did you eat?" And second, why do certain meds cause you to be bloated and constipated? So first question is, let's talk about foods.
Okay, so they kind of go hand in hand. And I'm going to kind of like loop them together. So gabapentin, one of its side effects is essentially slowing of the GI tract. And also it's a bit
Mm.
drying. And so those two things together cause increase bloating and gas and constipation. So the GI tract is moving slower, it's squeezing slower, and you're getting decreased motility. And because of that, and also it's drying, which leads to constipation and overgrowth and less absorption and things like that. And so those two things make you bloated. And sort of similarly, you can imagine if you eat a very big meal, especially fast, your stomach does not empty right away. It's not like you eat something and it's automatically into the intestinal tract. It takes about 2 hours for at least 50% of the stomach to empty. That's
Wow.
normal gastric emptying. And so, if you imagine that you eat a big meal and you fill your stomach, it's distending like a balloon, It's like if you're putting sand into a balloon, it's gonna even though it's not, sand and water, it's going to stretch out, and that's what's happening to your stomach. So literally it's filling with air and contents and making you feel bloated, and you are bloated.
So which foods is it speed or is also what you're eating that can cause bloating?
It's all of it. So you can eat a like very it's volume of food. So if you eat a lot, or you eat very fast, it's just a matter of the stomach being full. But also, like, if you are eating a lot of gas forming foods, you're going to be bloated because of air throughout the intestinal tract. So you can kind of get this bloating in the stomach from fullness, and then there's also sort of bloating even as it passes. If you're eating like, beans, they're good for the heart. The more you eat, the more you fart, because there's so much air from all of their big gas forming foods, legumes. And so, you have all these bacteria that are forming gas throughout the colon from that. So there's all bloating is not just in the colon, in the small intestine, in the stomach. You can get bloating from air being in multiple different organs or multiple different areas along that tract.
Ooh, like what other organs? This is
Well,
interesting.
well, so like your stomach is an organ, right? And then your small
Mm.
intestine and then your colon, those are different organs. So people sometimes say, like, my stomach hurts. And I'm like, well, where? Right? Like, I need to,
Mm.
and in GI, a lot of times we try to separate, like, is this an upper GI tract issue or a lower GI tract issue? Are we dealing with colon? Are we dealing with stomach? Are we dealing with like first part of the small bowel, last part of the small, where are we, right? Because it's it's many, many, many tens of feet long. So where are we along that tract, you know?
So when my 10-year-old nephew says, "Oh, my stomach hurts," like if he pinpoints where, then what's the remedy?
Well, it just depends. Um, so, I think first you have to figure out, like, why are you bloated, right? So that goes back to, is it constipation? So if it is, you got to start by pooping more, right? So that's like, I always make sure everyone is pooping
Poop
enough.
more.
You got to start with pooping, right? So let's make sure everyone's not constipated. So once we get there, then we have to try to figure out, okay, is there something else going on? Is there a malabsorptive condition going on, like celiac disease, Crohn's disease? Um, is there, inflammation, basically? And we can do that many ways. We can check labs, we can check stool studies, we can check colonoscopies, endoscopies, all sorts of stuff that can give us hints to that. Infections can do that, right? Like I mentioned, H. pylori. Other infections like parasites and things can cause a lot of bloating. There's breath tests. So, um,
Ooh, breath test.
mhm.
What is that?
So breath tests is how we look for SIBO, and similarly another condition called EMO, which is intestinal methanogen overgrowth. And those basically like we mentioned, they're overgrowth of bacteria that cause certain gases and make you bloated. Can also check for something called disaccharidases, which is like enzymes that metabolize sugar. So the most common one that everybody knows about is lactase, right? So if you're lactose intolerant, it's because you don't have enough lactase. But there's also lots of other enzymes like fructase and sucrase and galactosidase. And actually, we're finding out that lots of people in the USA are actually have something we call um, sucrose intolerance, and
Oh.
so they're, intolerant to the molecule sucrose. Lots of people are intolerant to sorbitol, which is a sugar substitute. Um, there are people that lack fructase enzymes. So sometimes we can check those in breath tests or on biopsies as well from the small intestine. So it's not a one shot, I feel bloated, here's the answer. Bloating can be, and sometimes imaging, right? You have to make sure that there's not something malignant going on, something spurious.
Mm.
Sometimes people can get bloating from problems with like a partial blockage, right? So if you have a kink somewhere along this very long tract, either from an adhesion or from a tumor or from um, something we call volvulus or whatever, small bowel obstruction, that can be on the differential too. So we sometimes have to do imaging. So there's a whole host of things that can cause bloating, and it's the most generic term ever. But if we rule all of those things out, like let's say you go to a gastroenterologist, you've had scans, you've had, um, scopes, things are ruled out, and they're like, no, everything's normal. There are like a lot of supplements that I recommend to patients to start with for bloating.
Okay, so we're getting into the remedies, but one sidebar question is, maybe we have a episode just dedicated to celiac, SIBO, and emo because these are all new terms for me. So yeah, can you define what is celiac, SIBO, and emo? I always thought about emo being that hipster term, like you're emotional. Now I have a whole new understanding what emo could be from a GI's perspective. So let's start off with celiac.
So celiac is a gluten allergy. So um, it is important to know that there are two different things. There is non-celiac gluten sensitivity, NCGS, and many, many people in the USA have NCGS, non-celiac gluten sensitivity. It is not able to be tested in any way. You're not going to be positive on endoscopy, on lab work, on skin prick testing. It's a clinical diagnosis. You eat gluten, you feel bloated. A lot of people will also get other symptoms like fatigue or joint symptoms. Sometimes people feel rashy. Um, it's unclear, honestly, if that is because of gluten or preservatives in gluten containing foods in the US. But suffice it to say, that's NCGS. Celiac disease is a true gluten allergy, and gluten is absorbed in the duodenum, which is the first part of the small intestine. Or I think we've mentioned this before, duodenum, who knows what it's called.
Duodenum,
Sometimes
yeah.
I even fluctuate in my mood, what I'm calling it. But regardless, the second portion of the duodenum is where gluten is mostly absorbed. And if you have celiac disease, if you ingest gluten, it is poison to that area of the small intestine, and it causes destruction of the villi, which are like little finger-like projections that absorb gluten, and it causes flattening and inability for the small bowel to absorb what it's supposed to absorb, which is basically vitamins and nutrients. And so you can become deficient in multiple vitamins like A and D and E and K and iron and, other fat soluble vitamins and things that are absorbed in the small intestine. So it is a true allergy that can be diagnosed both in lab work and in biopsy and in endoscopy.
Okay, thank you for that. And then SIBO and emo you mentioned are an overgrowth of bacteria.
Correct. So both are are overgrowth conditions. So EMO is intestinal methanogen overgrowth. SIBO is small intestinal bacterial overgrowth. So they're kind of similar in concept. It's just a matter of what gas the bacteria is producing. So usually we measure SIBO by measuring hydrogen because increased hydrogen gas is a product of bacteria, and methane is measured in EMO. So you can have SIBO and EMO, you can have SIBO, you can have EMO, you can have both. But that's basically the definition.
Feel like I'm in chemistry class, which I failed, by the way.
That's
So
so
I
sad.
did.
I was a chemistry major.
I know you were, that's why I'm telling you this. I'm more of the, like, English history, like, I got a 5 on APUS history, but maths and science, as an Indian, I'm a complete failure. Like, everyone who's Indian is a doctor, a lawyer, an engineer, and then you have a freakazoid like me that's, like, into poetry. I haven't written you a text poem yet, but I write poetry and chapter titles and, but this feels like I'm exhuming I, like, exert hydrogen and methane, that can all be tested, which is, pretty cool. Is there any correlation between jackasses and the level of methane and
That's a good question. I'm not sure. This is like such like a how they train you in med school, right? Like a patient's like that, and then you say like, "That's a good question." Um, it's not a good question. I have no freaking idea, Sonia.
Okay, yeah, because 'cause I've been hearing more celiac I've heard a lot about, 'cause, um, like, I thought I had a gluten intolerance, we did a celiac test, and it was a lot of elimination, but it's fine, but I've been hearing more about SIBO, never heard about emo, and definitely what we keep hearing is that it's more prevalent in the United States because we have so many preservatives. My friends who have celiac, when they go to the United States or when they go to Europe, they can eat everything. It's not a problem. Bread, croissants.
Well, no,
Ooh, that's a myth?
that is definitely not true.
Okay,
Your
say
friends who
more.
have non-celiac gluten sensitivity can do that, but anybody with true celiac disease cannot eat gluten anywhere in the world.
Anywhere.
Our gluten is no different than their gluten. Now, if you have non-celiac gluten sensitivity, that is true, and many people will endorse this that when they eat gluten in the United States or a piece of bread in the United States, bloating, joint symptoms, fatigue, but then they go to Europe and they can eat a full baguette. It has to be preservatives. I can't imagine why it's not. Um, but that gluten is the same worldwide.
That's interesting. Okay. All right. So that's if you truly have the allergy reaction with the little hairs, I remember that from science class, those little hairs are being destroyed no matter where you go. It's going to hurt you. But you're thinking it's the actual preservatives between what the United States has versus what other countries.
If you are not truly celiac,
Yeah.
then yes. And many people have non-celiac gluten sensitivity. Celiac disease is also common, but you know, it is important to know the difference because if you truly have celiac disease, no, you cannot eat a croissant. You cannot eat a croissant anywhere. In Egypt, in France, in the United States, anywhere. But if you have non-celiac gluten sensitivity, by all means, give it a go.
Okay. Fair. I'm so glad we're having this conversation. It's so helpful. So, one thing I'm hearing is one, find out why you're constipated or bloated. And two, what are some of the remedies, either from a natural perspective, medicinal supplements? Like, what do you advise your patients once you've identified where their belly hurts or why they're bloating?
Yeah. So, like we said, make sure you're pooping. Obviously, there is a fecal microbiome issue here. And so there is a role for trying probiotics here. And I do like to try, to have patients try probiotics when they're bloated. And I think we talked about this in episode 1.
Just a reminder of what they are and some
Exactly.
common
Where
ones.
you sort of, we don't really know, what everyone's ideal fecal microbiome is, but you can try when you're bloated different probiotics to see if they're generally helpful for you. So, you could try something like a probiotic that has something, these are long names, but like bifidobacterium or Saccharomyces, because those kind of probiotics have been known to be helpful with bloating and things like that. But just because they're not helpful for you doesn't mean that it's not a fecal microbiome issue. It just means we
Mm,
weren't really able to the few common probiotic bacteria are not necessarily what you needed. A lot of times people will reach for fermented foods, right? They'll say like, okay, I'm just going to like repopulate my fecal microbiome with sauerkraut and kefir. And I'm like, okay, but do it slowly because you think you're bloated now, you're going to start increasing these foods that literally have gas. They're gas. If you've ever opened a jar of sauerkraut, it's like that big gaseous pop because it's filled with gas and bacteria that produce gas. And so, yes, over time, those are helpful, but you have to start small because it takes a while to incorporate those bacteria into your GI tract lining. So start small, but yeah, feed the GI tract with healthy bacteria. You can
mhm.
also try, depending, I like to really recommend peppermint. Peppermint is a GI smooth muscle relaxant. So if there's sort of distension or spasm, especially if you're having lower GI tract, like constipation related or IBS bloating, like in the colon and the lower GI tract, I find peppermint to be really helpful. There's multiple different brands, but ideally encapsulated peppermint so that it releases, it's designed to release in the bowel and not in the stomach so that it works more. Um,
Mhm.
there's something called IB Guard, IBGARD, or Now Brand, NOW are two that I usually recommend. Now Brand also has one that has ginger and fennel with the peppermint. And, those are all known to be really helpful with bloating. Um, Sort of one of the newer supplements to the world of supplements, I guess, that I recommend quite a bit is berberine. I think berberine is really helpful with bloating. I generally recommend like 200 milligrams twice a day, but it just helps, especially with upper GI bloating.
What is it? Is it
Berberine is
naturally?
it's a supplement, and it just helps with digestion and bloating.
Okay.
Um, the other thing that you have to consider is remember how we were talking about food kind of sitting in the stomach and that contributing to bloating? So, a lot of times, patients get a lot of help with enzymatic support. So, digestive enzymes can be helpful with bloating because if your stomach is sort of emptying or it's slow and the problem or the upper GI tract is slow, if you add digestive enzymes or even natural enzymes like papaya or papain, which is the enzyme in papaya, those can be really helpful with breaking down some of the foods more quickly so that they don't.
What if you don't like papaya? Like, I don't. What's another food I could eat?
Well, you can use um, the enzyme that's in it. They make in a supplement. It's called papain, Papain. Um, so that can be helpful. Um, and then
Yes. Go
like
ahead.
there's diet too. So we've talked about FODMAPs in our IBS episode. So go back and listen to that if you haven't. But you know, FODMAPs tend to be more bloating foods, which are fermentable sugars. I like to tell patients FODMAPs are the foods bacteria like to eat. And so if they eat more food, they make more gas. And so lower FODMAP diets tend to be much better for bloating.
Okay. Um, I'm sure everyone can find that online, right? The FODMAPs and what are the foods low. Yeah. Um, some of the things I just want to reflect upon what you said. So make sure you are pooping more. So this is so timely because I'm trying gabapentin. I've been, thanks to you, I've been eating a kiwi a day, and then also having coconut oil, having more water, and then like prunes and figs,
Magnesium?
magnesium. Which magnesium am I supposed to take? Not citrate,
Yeah,
right? Am I
citrate. Citrate.
Okay, magnesium citrate. What can I find that in my diet?
Mm, I'm not really sure. I usually just recommend, I mean, I don't think you can get enough of it. I would say just take it in supplement form.
Okay, yeah, because as a IBD patient, I have to be careful on how much magnesium citrate, and then, um, yeah, and things to cause lubrication, lotion, motion. So I've been doing that, and then the other thing is, this season I've been making yogurt from scratch, which is really cool. When you come to Cali, I'm gonna feed you yogurt from scratch with the Indian rotis I've been making too. Because the way mom's taught me to make it is, like, you ferment it all at or, like, you make it with the starter, and then it sits for 7 hours, and you just let it sit. You wrap it up, you swaddle it like a baby, and you just let it
Pat,
sit
pat,
for
pat.
7 hours, and it's emotional, right? I'm an emotional cook, so that day Shimmy and I missed it. It wasn't 120 degrees when I swaddled it, and my yogurt flattened, but I made paneer out of it. So, I think Dr. De Silva told me, like, eat more yogurt. So, what is yogurt doing?
Well, yogurt has bacteria. It's fermented, right? What are you doing when it's sitting there for 7 hours? It's fermenting. And
Mm.
that's forming bacteria. And those bacteria are generally pro and prebiotics, which are helpful for the GI tract. We need more of those sort of quote unquote good bacteria. I always like tell people it's like a battle zone in there. Like you
Ooh.
just need to have like the right amount. It's like armies, like the good bacteria army and the bad bacteria army. And you just need to overcome the bad bacterial army with more good bacteria. Like it's not about having no bad bacteria. It's just a balance. You need some of them. Everybody needs an army. It's just a
So
matter of
who are some of the, like, Lord Vader, the bad bacteria that we do not
well,
want?
that's what I said. They're mostly like the hydrogen producing organisms, the methane producing organisms.
Mm. Methane producing. I feel like we should play da 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 like Darth Vader's theme music, right? Because you
Right? Yeah,
want
like maybe the probiotics are the stormtroopers. They're coming in to fight evil.
stormtroopers are evil.
Oh, shoot, you're right.
No, wait. The
Oh, shoot, you're right.
stormtroopers are the dudes all in
The
white,
stormtroopers are
right?
the bad ones. You're right. Um,
Yeah.
what are the good
The
ones? The
Yodas and the
Siths? The
Grokus and the
Siths?
Pedro
Is the Sith
this
army? Is that the good ones?
the
Bad too?
Siths are
They're
they're evil. You gotta think Pedro Pascal, Grogu. You have to think Luke. Although, Pedro Pascal is hot, by the way. Do you not find him just he is a good
I don't
looking
even
and
know who
kind
is Pedro
man.
Pascal. I don't know who
Mm,
that is. Who is that?
what?
I don't know who that is.
Kara, we need to like put a picture of Pedro Pascal right during this part of the
Is it
episode.
just some hot? Who does he play in Star Wars?
Mandalorian. He is the Mandalorian. Yeah. So clearly there we need to get our armies right with the dark side and the light side. But okay, yeah, it'd be helpful for us to like all discover what are the good bacteria and what are the bad bacteria. And sounds like the lower FODMAP is a way to go to help you identify what those foods are. Um anything else about like how to manage the bloating. I mean, I can just tell my tummy's distended, but it's not causing me a great deal of pain, but I know for some people it does cause pain.
Yeah, I mean, in addition, I tell people all the time, like, the more you move, the more you mobilize the gas. So, just going for a walk is helpful. Um, Also, yoga, especially, I tell people, like, remember, especially women who have been mothers, or if you've ever babysat a baby, we push their knees into their chest, right? There is something to be said for, pulling your knees up into your chest. And the reason we do that is because it puts pressure on the GI tract, and it can help move air. And there's actually, people that do sort of GI massage where they kind of push in the direction of the colon to try to mobilize gas. I'm not sure. Maybe it's helpful, maybe it's not. But I think the whole idea behind it is to just mobilize gas. And so the more you move, the more you're bending over, the more you pull your knees into your chest, it kind of helps move that gas around. Um,
Yeah, thank you for mentioning that. So, thanks to Dr. Parekh out at UC Irvine, I found a yoga teacher. He's great in India because the way we do yoga in India versus the way we do yoga in America is a little different. And doing that twice a week has helped with some of the bloating and also oh crap, there was something else you said. You said yoga and oh yeah, my pelvic floor therapist. Like I didn't know this. And it is covered by insurance for many when you have IBS or IBD. But if you actually just go to a pelvic floor therapist, they massage you and things move. Um, but do you also recommend like stool softeners or any of that stuff when you're bloated or to
Generally,
get
I
things
don't. I
moving?
generally don't
Okay,
recommend stool softeners. I don't think stool softeners do a whole lot. There's not much good data on stool softeners. So I use them in very limited quantities.
that's good to know.
Yeah. Stool softeners, no. And then, water, obviously water, none of us are
Water.
drinking enough water, but water is helpful in bloating especially when you're constipated, because water helps move stool. So more water, more bowel movements, less bloating.
Yeah, and I usually when I'm bloated, I'm usually hugging my yoga pants and the savvy jeans you told me to get, like anything that's soft and expandable, maternity jeans, just because I need to let things be and let things expand and contract as they wish to be versus fighting it.
Yeah, I mean,
I'm
some
like,
of it is
okay.
understanding that there is a daily bloat that happens in everybody. It's not abnormal to have more bloating as the day goes on. It's because, we start the day with an empty GI tract, and then we start filling it, food, liquid, stress, we're not moving, we're sitting at a desk all day. All of these things compound the bloating all day long, right? And so it is there is some degree of normal to it. That being said, you know, most of the time, by the time people get to my office, it's impacting their daily life. And
Yeah.
so that doesn't mean that I'm telling people, just accept it. We should definitely be managing it if it's enough to bother you to get you to the gastroenterologist. But some degree of bloating at the end of the day is normal in almost everybody. But if it's bothering you, and it's new and it's worse and, whatever, that's the reason to see me or
Yeah.
someone like me.
Um,
You don't just have to see me.
um, I like seeing you. I like seeing you every week. I think that's it. Again, if you have questions or comments or any ideas on what would help, like leave a comment on YouTube, Instagram. What else are we on? YouTube,
Yeah.
Instagram.
I mean, also follow the podcast on Spotify, on Apple
Oh yeah,
Podcasts,
and
on
Apple Podcast.
YouTube.
Thanks again. Yeah, and if there's anything you're curious about, let us know. Because we're delighted to have these conversations together and you get to share and hear. So thanks, Dr. Soika.
Thank you, Sonia. It was a good one. We'll see you guys in a couple weeks.
Bye.
Bye.